The information provided on this podcast is for general informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your qualified healthcare provider with any questions you may have. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. Reliance on any information provided here is solely at your own risk. Welcome to the Birth Baby Podcast. Each week, you'll find guidance, encouragement, and practical tools to support you through pregnancy, birth, and the postpartum journey. I'm your host, Ciarra Morgan, a certified birth and postpartum doula, hypnobirthing educator, and pediatric sleep consultant. I'm also the owner of a doula agency in Austin, Texas, and the founder of the Birth Baby Academy, where I offer classes for both parents and birth professionals. Thanks for being here. Hello, everyone. Today I have a special guest, Shamrea Marquell. She is a mother, artist, and the founder of Wickedly Authentic, which is a brand rooted in self-expression, healing, and reclaiming identity. Through her work, she supports women as they move through major life transitions that often result in hair loss. And her goal is to help remove the stigma of wearing hair alternatives. It's never just hair. She actually is I don't even know what's the right word. She cuts my hair, and she's cut my daughter's hair since I have a 15-year-old, and I think you've been cutting her hair since she was like 4. So she is here to share her birth story with us. And I'm so happy to have you here.
Thanks for having me. I'm really excited. I was like, I don't know what kind of input I have, but we'll share the journey.
Hey, all of the stories are important, no matter the outcome or the way that we got there. So, and you're just such an interesting human in general. I just really, you just have your own presence. And for those listening, it was funny. She tried to go from having a chair in a place by herself, and then she moved to a big salon. And all of the people who go see you love you because you're you and because you're stupid fast. And I'm like, I love that I can get in and out quickly. This is efficiency. And then everyone's like, but this isn't the same. So she moved back by herself, y'all, so that we could just be as crazy as we want to be in her chair.
Yeah, we can be uncensored now. It was interesting being a little censored. Yeah.
Yeah. You don't do well with that. That's not you.
Don't.
No. So tell us a little bit. How old is your kiddo now?
He's 9.
Okay. So 9 years ago, a little over 9 years ago, tell me a little bit about your journey of getting pregnant and how pregnancy was for you.
Okay. So the getting pregnant was really funny. Like for the longest time, I was like, no kids, never, blah. And then on our wedding day, Jacob was all like, it's a deal breaker. And I was like, fine, I'll give you.
On your wedding day?
Oh yeah. He's like,
late notice, dude.
Back. I was 23. And he's like, just so you know, like I was serious when I said I wanted kids. Like my husband has wanted to be a dad since he was like 7. Like the man was meant to be a father. No denying it. Mm-hmm. And I was like, I grew up with 5 siblings and I raised them. I don't want kids. I want to live my life. I want to do me. But then I get that text and I'm like, all right. We'll shoot for 1. I'll get you 1. In the back of my head, thinking like, I can't get pregnant. It's not going to happen anyway, but I'm going to give it the good old try.
I'll make him think I tried.
Yeah. I'm going to put in the effort because when I was little, there were a lot of complications. My mom delivered me and I was told that there could be a chance that I might not be able to carry kids. So I'm like, cool, whatever. I was on birth control, so it's fine. We weren't just shooting blanks. Anyhow.
Yeah.
So now we're at this point and I was like, okay, we're 23, we're married, and we wait a few years. And I was like, well, if I'm not pregnant by the time I'm 26, then we're calling it. Like I'm such a control freak. I can't handle myself. Like I try to be type B. I work really hard to look this chill, but I'm not chill.
You do, because no one would guess, I don't think, that you are the way that you are, because your persona and like the air that you give off is like free spirit. Everybody do what you want. And you're like, yeah, but only if it's this way.
Yeah, no, I'm like behind the scenes, like the Wizard of Oz, like moving everything so that it feels breezy. It's not breezy over here. It's not. It's not. Yeah. So I like sat him down and I was like, if we're doing it, we got to do it. And we got to plan this out. And he's like, well, I don't know. And I was like, well, let's go do on a cruise. And so we booked a
baby making cruise.
The baby making cruise. That's all it was. We told the whole family. I was very open about it. I was like, we are going to do it and we're going to have a baby. So we're getting on this cruise. We're like 26. We're having the best time. There's this family there. There's like 40 people that we don't even know. I start, I'm
They're your
drunk.
new best
I'm telling
friends.
them, I'm going to get laid and have a baby. And like, we're all excited. Yeah. Literally every day we walk by them, they ask us if we've done it.
Oh
so God. We're like, at one point, girls are cheering outside the door for us.
Stop.
Like we had, because I'm all about group effort, like the collective, right? The energy.
Yes,
and I'm like, if I have enough people invested in this, there's no way it's not happening.
You're manifesting it.
I'm manifesting it hardcore. And I really feel like I know when it happened.
That's hilarious.
Like I feel like
you probably do.
Happened.
Yeah.
Yeah. So we get home, we get out of the boat, like all of that stuff. And I'm like, I'm pretty sure in the way, this is like, maybe not the most appropriate way how I figured it out, but whatever. So we're at the house. It's been like a few weeks and I have 3 dogs that typically don't get along. They don't really like each other. They're all kind of like hodgepodge together. They fight over their attention and they're at the end of the bed sitting with me, loving themselves.
Energy shift.
And I smoked a whole bowl and I couldn't get high, which was crazy. I was like, is this just like fake weed? Is this oregano? I don't know what the f is. Like I should be out of my mind and passed out. I mean, it's not like I don't sleep. And so I was trying to make myself go to sleep.
Right.
And I was like, no way. There's something up. So I got in the car and I drove to the 24-hour CVS. I grabbed a couple of those little pregnancy tests, all of them, as many like that I could afford at the time. And so I come home and I pee on him and it's pregnant. And I was like, whoa. So I threw all the weed away. I kissed the dogs. And then I'm like tiptoeing around the house because I know that Jacob has to get up early. He has to work another double. Like he was working so many hours. And so I'm just like, oh, I don't want to wake him up. So I set it on the back of the sink. Mind you, we live in a 900 square foot cabin at the time, like tiny. You hear everything. So when he gets up in the morning, I hear him squeal like the tiniest little mouse, but very high because he was trying not to wake me up. And he was like, it was like crazy. And he was ecstatic and he didn't wake me up. He was trying so hard because I was finally sleeping.
Yeah.
A lot of mutual respect, which is great. But then I come out and then we celebrate and it's this big thing. And then the whole time it was like hard to not tell anybody we were pregnant, especially for the first,
best secret ever.
Yeah. Best secret ever. But I definitely messaged a couple of the girls on the cruise that I met and they blasted it everywhere on Facebook. They're like, oh my gosh, you know that girl? She's pregnant.
That's awesome.
So the magic of the Carnival cruise gave us our baby.
Yeah. And then how was your pregnancy? Was it easy for you? Was it complicated?
It was amazing in the beginning. No morning sickness. I gained very little weight. It was eerie how calm I was. Like the whole type B persona that I try to create was there without effort. I didn't have any more food aversions. I felt very balanced. I was sleeping 8 hours. My bowel movements were phenomenal. Like all of the things.
Your body was made to be pregnant, at least in the beginning.
It was great. It was to the point that even my psyche was so good because you know that I battle with like PTSD and I, all the stuff that I endured and so forth as a child. And it was just like I was like Bob Marley, don't worry. It was weird. It was eerie weird where people were reaching out to Jacob asking if he was okay. Like my own therapist was like, what the fuck?
Yeah.
She's just so chill.
Yeah.
So that was great until the 3rd trimester. He came about 2.5 weeks early. I got the puppus rash.
Oh, pups is the worst. It's so itchy. For anybody who doesn't know, this is like a rash that goes at least on your stomach, but sometimes over people's whole bodies. And it is so itchy. It's miserable.
There's nothing you can do about it. You're basically allergic to the baby.
Ugh.
Yeah. So like amniotic fluid was secreting. My liver was struggling to maintain him. At one point, like the rash had gotten so bad that I got shingles on top of the rash.
Oh my gosh.
So then now I had all these open sores. I'm in the bathtub with oven mittens that Jacob had taped to me so I wouldn't just tear, because I was tearing myself apart. And then I don't know what, but some like weird water weight happened where I put almost 20 pounds on in less than 24 hours. So like
It almost
lesion
sounds like
this big on
preeclampsia.
my thigh was just opening up, and the doctor was like, well, there's really nothing we can do. And, you know, this is kind of where it's at. My doctor was now on her own maternity leave, so I didn't have her anymore. My whole birth plan that I had with this woman, because we had like gone in the state of Texas at that time, you weren't allowed to elect for a C-section. You had to try to push your first pregnancy vaginally for insurance reasons. Yeah.
I've never heard of this, and now I'm going to be researching it.
Yeah. So it was like, this is your first pregnancy. Insurance doesn't cover C-section electively, so you have to try vaginal unless it's an emergency. But my doctor and me came up with this game plan because of all the sexual trauma that I endured as a child, that like, it wouldn't be
you should get to choose whatever the heck you want.
Right.
Anybody should, but especially,
Yeah, but she wasn't my doctor anymore.
Oh my god.
And so we're like at this last moment. And so we go in to get induced, which I don't know if I would ever recommend that to anybody.
It's pretty rough. And honestly, I'm not a fan of induction, and it would have to be a lot for me to consent to one myself. But what you were going through with the rash and shingles and water, I'd be like, yeah, sign me up. You do whatever you got to do to end this game.
I know. I feel like if they would have just done the C-section, I wouldn't have had to be induced. I don't know. Is that right? Like,
right. You would have just gone in and gotten a C-section.
And it would have just been done, and it would have been better. But
a few hours later.
Yes. And that's what I wanted. And then I got this other lady who was not my doctor, didn't know my history. She manually broke my water. I elbowed her in the face. 2 nurses had to hold me down.
Yeah, like, they didn't know what they were dealing with.
I was feral. And my husband was like, she's got trauma. You can't touch her like that. And like, he's like trying to advocate. And then finally the lady like hears him and she's like, oh. I'm like, yeah, read my chart, lady.
Yeah.
Like, it's all over there. Like, you can't be manhandling me down there. Like, what? No, we don't make eye contact with that area.
Yeah.
What are you doing? And so I was at a 4 dilated. I was still making phone calls. I was still booking clients. My pain chart was going, but I wasn't really feeling it.
That type A thing was coming in.
I was like, I have weddings to finish. I have clients to cancel. Like, this baby is coming. They had nurses coming in. They're like, oh my God, how is she still working? Because my chart, I don't know what that chart is, but
it probably was just them seeing your contractions on the monitor. They saw that you were having them.
But I wasn't really feeling them.
Yeah.
It was hyperfixated.
Were you on I'm assuming you were on Pitocin or something like that, probably.
Yes, I was on the Pitocin.
Yeah.
And then, I refused the epidural because I was told that if I had an epidural, then if I went into an emergency C-section, that they would have to sedate me and I wouldn't be awake during the C-section, and that my husband couldn't be in there.
Oh my goodness.
Yeah, it was crazy. So I didn't do the C-section. I meditated on reverse dilating. I was like...
You meditated on reverse dilating. Said no one else ever in the whole world except Shamrea.
I was like, close this shit up, close this up. Baby's not coming this way. My husband was like, what? I was like, no, we just have to picture the baby in a C-section. He's not coming out of my vagina. It's not coming out of my vagina.
You are hilarious.
I wasn't doing it. I did not want a vaginal birth. And this lady was super, super wanted one. And I was like, absolutely not. But everything happens for a reason. Because the first doctor I ever interviewed with was known for cesareans. She was this redhead with curly hair. I can't remember her name. It starts with an F. My doctor got tired of me, or she had to leave, or her shift, or whatever. I mean, I did hit her in the face, so I understand.
Right.
Whatever. So she leaves, and the other lady walks in. She's like, you ready to cut this open? And I was like, what?
You're like, somebody's speaking my language.
Interviewed with.
That's funny.
Yeah. And my scar is beautiful.
Well, she was a good surgeon.
Yeah. I like laid down. I was fully awake. I didn't have to have the epidural until right before.
Yeah. They do a spinal usually with the C-section. Yeah.
Amazing. I laid down. I didn't get to see anything I wanted to. They said I didn't want to. And I was like, I've watched a lot of videos. I really wanted to see it. But I didn't get to see it. And that's fine. Whatever. They pull him out. He screams. My first word is, he sounds like a dead cat. It was weird. And then I looked over at Jacob, and that's when it was like, this is it. This is why I did this.
Oh, that just gave me chills all over.
Yeah.
Him was a daddy.
He was a daddy and he was meant to do it. And I had a baby with the right person.
Oh, it makes me
and
cry.
It made me the mom that I never thought that I could be.
Mm-hmm.
And it like all kicked in, and it was good. It was really beautiful.
That's so awesome. So how was recovery for you, and how did he do it with everything as a newborn?
The baby was great. Byron was awesome. He slept. I did not wake him up every 2 hours like they suggested. He slept anywhere between probably about 4 hours on average, fully, just out.
Nice.
I breastfed for the first week, but I wasn't producing any milk. So I think he was just sleeping out of exhaustion because I would like pump and I couldn't even get a half ounce. Like it was just not happening, which secretly, not so secret, Jacob's dad was very excited about, because the second he found out we switched to formula, Bill was
now he gets to feed the baby.
Oh my God, he was so stoked. He was like, give me that baby. And
Grandpa wanted feeding time.
All of them. All of the men were just like, give me the baby. I mean, when we delivered Byron, Papa was already in the waiting room waiting, and he had his shirt off for skin to skin.
Oh my God.
A man in his late 60s, so not normal.
I love it so much. Well, you know my family, and you know my stepdad, and I call him a stay-at-home grandpa. Like he started taking care of my son when he was 6 weeks old and I had to go back to work. Grandpa took him. Like we have some good men in this family and in yours. And same with my husband's family. All of the men are just amazing dads. Like they were bred to do it. So that's so cool that was your experience too.
It was really rad. So Byron was great.
And how was your healing?
The C-section was not bad. Like physically, I was great. Like I was up and moving. We were out by like day 3. I went shopping with him the second we left the hospital.
All of you listeners, do not do that. Your pelvic floor still needs rest. Doula over.
It does. She's right. But the problem was we left the hospital one size and I was bigger.
Oh.
So I had to go get pants and stuff.
Wow.
I was literally a whole size bigger from all the water retention. And from
Did they
that
ever
extra
figure out
20
what was
pounds,
going on?
My body was just, get this thing out.
Yeah, it was on strike.
I was just rejecting him and my liver couldn't process the amniotic fluid. And then them pumping me full of fluids to try to maintain it just was not.
How long did it take for that to start to go away for you?
At least 2 or 3 weeks.
Wow.
It was a lot. I had a massage therapist who's my friend come over and like work on my legs. Like you couldn't even tell the difference between my ankle and my leg.
Oh gosh.
It was all
Sounds
one
painful.
bog.
Yeah.
And I thought I was cute in my pictures because I didn't have a mirror there. Do you know what I'm saying? If I showed you these pictures, I'll send you some of these. And you can just
I want to know.
I literally looked like Miss Piggy and a duck had a baby. I was posing. My friend came to take pictures after he was delivered. I braided my hair on the side because I'm a hairdresser. I thought I'd be so cute. And I'm like, look at my baby. Look at my baby and my husband. People are damn lying.
But good. Well, I'm glad. Isn't it better though? It's better that you felt good about yourself.
I did. I thought all that weight was gone the second the baby came too. I thought everything was going to be like, oh,
bam, snatched again.
None of that happened for a while.
Yeah. No, that's great. So you said physically you did pretty well. How about mentally? How was the transfer mentally? You ended up getting what you wanted. Postpartum sucked.
I definitely had a lot of mental psyche. I think so much of having a baby is a loss of self. And if you haven't, to any new moms out there, what I would say is start journaling about what your new life could look like and what it may look like, especially if you're a control freak, to kind of just understand that if you have any childhood trauma, it's going to come up. The feeling of being abandoned, the feeling of working through your abandonment issues. Like I've been in therapy for over 20 years and nothing hit me as hard as having a kid. Like anything and everything that was unresolved happened within the first days of him being born, and it all came up. And I was like, oh, it's a sense of loss of self, but it's also the most selfish thing that I can do. And how do I do this right? How do I ask for help? I wanted to do it on my own and make a point, but I couldn't do it on my own. So there was so much, and my hormones were so jacked up.
Yeah. I think a lot of that, and not everybody reacts the same way, right? But many people who had have trauma from their childhood or had parents that were less than great, when they can sometimes be like, well, I'm going to be the best parent then because I didn't have one. But then sometimes what happens is almost like, I want to be the best parent. I'm not saying this is what happened to you. Maybe it didn't, but it's like, I want to be the best parent for my child. But then it's also just making me reminded of how much I didn't have. And almost like I'm jealous of the life that my kid's getting because like your inner child is still mourning and like being reminded all the time of what you didn't have. It's just this weird dichotomy that can happen. So people process everything differently, but I think people don't realize that even though you're doing everything you can to make it better for your child, that doesn't fix it. And having a therapist before you already had one, but some people don't. And so having a therapist before you have the baby, before you give birth is so important. So you can start processing some of this and already be established with someone postpartum so that if something comes up, you have somebody to talk to and don't have to now explain your life story postpartum to somebody.
Right. When you're in the thick of it. Yeah. So I definitely have a therapist before. And it wasn't jealousy for me. I can see how that happens though.
Yeah. Some people,
For me, it was like, I didn't have a good role model. So what the fuck am I doing?
Mm-hmm.
Am I really capable? And the thing that kept me going in the back of the head was like, if I mess this up, Jacob won't.
I was about to say, you knew Jacob had you. Like,
yes.
You could kind of watch him and he was modeling behavior.
Yeah. And I just I disassociated a lot for the first year, which was crazy. But when I look at pictures, I'm very present, but not present. I don't know how to describe it. Like, everybody's like, oh, you were such a good mom. You were really in. I did all the diapers. I did everything. But it was like almost like this autopilot, whatever of survival. And then I'd say like a year and a half in, it was like the cloud, this like film came off of me. And I was like, whoa, I'm a mom. And this kid is so rad and it's so great. And I'm still going to have my life, but it's going to be so much better because now I've got a permanent travel buddy. Like I've been traveling with him since he was 3 months old, taking him all over the States, out of the country. Like he's the kid already yesterday. He was like, when are we leaving the country again? Like, he likes to go.
Yeah, I remember many, many years ago, because I knew you before you had a kiddo. And I remember a time when you said, or maybe it was right around that time, where that kicked in for you. I remember seeing you're like, man, this kid's so cool, and you just started being so obsessed with how cool he was. And I loved seeing that. It was really cute to see you just like enamored and going, wow, like the possibilities are endless with me and this kid, Yeah.
Yeah. It's healed a huge part of me. Like when I get to see him do cool shit, it's like, I get to be a little bit of a kid too with him. So we're playing all the time and it heals a part of me. And then I'm like, pat myself on the shoulder, like, oh, I did that. Like, I'm doing this. Like I'm giving him what I would have wanted and then some.
Yeah.
And a lot of open communication and a lot of things like that. And each age is different. Each age will bring up a different emotion, a different feeling, a different thing to like work through. I wasn't the most emotional person. And then now I see a school bus go by and I just start crying. Like I am so open and vulnerable now. I'm like, oh my God, you're stuck on a bus and you go to a school for 8 hours and it's like a prison system and you don't get to be by your mom. And I'm like, I'm an active like advocate for public school, right?
Yeah.
But also, why can't I homeschool you and keep you forever? Because I'm obsessed. Because I'm not the world's best teacher. We know where we're at.
Oh, girl, me either.
So
only to adults. I can teach adults, not kids.
Yeah.
I'm so thankful for teachers.
But man, I cry at Olympic commercials. I cry at everything now when I couldn't cry before.
I think that's such a good point that you bring up, that just because you processed things and things got better, quote unquote, around that, like that veil was lifted around a year and a half old, it still doesn't mean that it's fixed. It's like every age, something new may come up. You may have to process something new. Something may trigger you that you didn't even realize was a thing. Yeah. And that can happen to anybody, but especially if you have some things that you're bringing with you. So that is, I love your story so much. And I'm so thankful. I love especially too, that you like owned the fact that no, I wanted a C-section. And I think that some people are ashamed or embarrassed. And for me, I'm just like informed consent, man. And if that's what you decide at the end of the day, I'm going to stand right there with you and let's get that C-section. You know, as long as you know what you're signing up for and you have your own reasons, I have nothing about it. It's not my birth. So I think that you are so authentic and so wholly you and unapologetically you. And the world is a better place because you're in it. And I just really appreciate you coming on and telling your story.
Yeah. Thanks for having me. That's been great.
If anyone wants to learn more about this wig thing that you do, because you're the queen of it, can you tell them how to find you on social media? And I'll put it in the podcast show notes as well.
Yeah. So my Instagram is wickedly authentic. It's wickedly_ then authentic. That's the best place to reach me. I have my link tree there. I have my booking link there, all of those things. So yeah, that's the best spot until I build my website.
That's always a work in progress for everybody, I think.
So much work.
Well, thank you so much for being here.
Yeah.
Thanks for listening. If you enjoyed today's episode, please take a moment to follow, rate, and review the podcast. It helps us reach more families who can benefit from this resource. For more resources, classes, and services, head to empoweredbeginningsatx.com or check out the Birth Baby Academy at birthbabyacademy.com. Until next time, wishing you confidence and calm on your journey through birth and beyond.